the number one question I get from people is this. But wait, you don't do regress to cause. It's the only approach to hypnosis I know. I don't even know what else to do with hypnosis other than regressing to the cause. What is it that you do instead? So here are the processes that I use with addicts or most of my clients instead of regress to cause. Number one, mindfulness-based training. It was the great Master Oogway who said, yesterday's history, tomorrow's a mystery. All we have is the present, and that's why it's a gift. If you don't know who the great Master Oogway is, that is, of course, anyone know? Scott.
He's the sensei, Kung Fu Panda.
Yep, he's the turtle in Kung Fu Panda. And I actually think, I've done the research, he actually stole the quote from Eleanor Roosevelt.
Say it again, please.
Yesterday's history, tomorrow's a mystery. All we have is the present. That's why it's a gift. The reality is, no matter where we've been and what we've done, it has actually brought us to where we are today. But we can't change any of it. It doesn't really matter what the cause is. The fact of the matter is I need to stop. I worked in the probation department for a number of years as a substance abuse counselor. And, you know, for the guys who were on probation, where a motion for revocation meant going to prison to finish out the rest of their sentence, it was real simple. It doesn't matter why you use cocaine or why you drank. It doesn't make one bit of difference. The only thing that matters is that you don't. We don't have to understand why we did something in order to change. You see, when we live in the moment, when we practice mindfulness, everything's actually okay. I used to be afraid to fly. Now my wallet looks like a who's who of travel cards. I would not get on a plane. Wouldn't get on a plane, wouldn't go in an elevator, and wouldn't go in traffic. Wouldn't do any of those three things. Now I have a US Air Visa Gold card that I guess is going to become an American Airlines card. I'm Executive Platinum on American Airlines. I have my Southwest A+ preferred top level card, which means I get the free crappy Wi-Fi. That's the only benefit to having one of those on Southwest. And now I fly all the time. I'm still afraid to fly sometimes. It was pretty bumpy coming into Orlando yesterday. The pilot even announced, for those who might not be relishing in the fear of flying, although it's been a very smooth flight so far, it's going to be terrifying as we land in Orlando because there's a lot of unstable air. There's a storm to the left and a storm to the right, so get ready for some bumpiness. I mean, he actually announced that. I was like, really? He's going to freak everybody out, give them anticipatory fear. So of course, I responded to his hypnotic suggestion with fear of flying. And then I remembered what I'm always telling my clients. As long as you're breathing, you're actually okay. Now, this is really useful if you're flying an airplane when there's a really rough air. This is also really useful if you're about to undergo cancer treatment that may or may not save your life. This is really useful if you're having to deal with the pain of raising children. I've raised enough of them that every now and then, as long as I'm breathing, it's actually okay. And as long as they're breathing, it's actually okay, right? And so you have these, the moment is actually always okay. This is why mindfulness is so powerful. Right now, this breath, this moment, just breathe in, breathe out. This moment, this breath, actually everything is exactly the way it's supposed to be in your world. You got real stuff going on in your real world, your practice, finances, pick people up, do this, your room's got mold, we're at the beach, what do you expect? You know, all this sort of stuff going on. All that really is real, but as long as you're breathing, it's actually okay. Now, this is really useful for my weight loss clients. But I want a Twinkie, or I want a donut, or I want, you know, a Big Mac. You know what? As long as you're breathing, you're actually okay. You don't have to satisfy that craving right now. For the cocaine addict or the alcoholic, but I want to get high. Stay in this moment. This moment is actually okay. This moment is actually okay. It's real powerful. So I teach my clients how to practice staying in the moment. And it's a practice. And I teach them mindfulness, and I teach them strategies to bring their attention back to the present. I have them practice this. A lot of people think meditation is about clearing the mind. Well, that would be impossible, wouldn't it? Because minds think, that's what they do. If you try to get into meditation or self-hypnosis to clear the mind, you're going to go crazy. Because like a fish swims in water, a person swims in thought. So it's not possible to think of nothingness to clear the mind. Everyone I've met who's gone on these crazy retreats and paid zillions of dollars to these meditation programs so they can clear the mind just ends up incredibly frustrated and a little weird. It's a lot easier in meditation to take a mindfulness approach and not try to not think or not feel or not sense, but instead to use those as an indicator or a cue that it's time to return my attention back to the breath. So what I do with my clients, often before I even do a hypnosis session, is I say, I'm going to teach you a strategy called mindfulness. And they'll say, okay. And I let them know that when I do this with clients, I've never had anybody yet say, oh my gosh, that was life-changing, thank you. But when you practice this each and every day with attention between now and next week, you're probably going to come back like most of my clients. They'll say, wow, that was life-changing. Because the research shows, there are actually people who research this, that most of us spend our time dwelling on the past or fearing the future. And we miss the moment. And right now, everything's actually okay. Can you think of a better place to be than with these awesome people that are around you? Look around the room. It's pretty cool. I'm glad to know all of you. It's pretty comfortable in here, isn't it? I mean, we have these beautiful green chartreuse banquet chairs. There's really no stress in here. There's nothing you can solve or do it right now, is there? I mean, you can't go pay a bill right now. Right? You can't fix anything with your spouse, your child, your next door neighbor. Right? But right now, everything's actually okay. If my clients can stay in the moment, everything's actually okay. That's a great place to be. And we have to, because we're not programmed to live in the moment, practice it. So I give my clients an assignment, and that assignment is, now that we practice mindfulness in my office, focusing on this moment. The breath is often a marker for this moment because we always have it with us. We can practice mindfulness in a lot of other ways. There's not magic in the breath. The reason why the breath is often what we focus on is because you always have it with you, so it makes a great practice focal point because you have it with you when you're afraid of flying or arguing with your spouse or whatever else. You always have your breath with you. So, and if you don't, then you should worry. Okay? But until then, everything's really actually okay as long as you're breathing. So I give them this assignment. Take the MP3 I'm giving you, or emailing you. They usually email too, so they can download it to their phone. And it's 3-4 minutes long, and practice with intention each and every day, twice a day between now and your next session, being mindful. I don't give my clients 30 minutes hypnosis sessions anymore. I don't give my clients a session of a copy of the session I just did, a used hypnosis session. Instead, I give them a skill they can practice, which is mindfulness. So I also find that when I don't, I used to have clients who years ago, they'd come in and I'd say, did you listen to the CD? No. A lot of them didn't. And because 30 minutes is too long. So I give them a 3 or 4 minute MP3 to listen to, email it to their phone, and they come back in and they say, yeah, I listened to it, maybe not twice a day, every day, but they listen to it 3 or 4 times during the week. Wow, that means yes. It kept them engaged. It increases our likelihood of success. So rather than regress to cause, I help people live in the present despite the causes, no matter where they came from, no matter what those difficulties are. The second process is about acceptance. And this is the one I'm going to guide you through. I'm going to let Scott talk for a minute. Page 449 of the Big Book of Alcoholics Anonymous, and acceptance is the answer to all my problems today. When I find some person, place, or thing, I'm not going to remember it by heart at this moment. Google page 449 Big Book. You're online, right?
What?
You're online, right?
Google it.
Google something for me. Just Google page 449, acceptance.
What's it?
That's the afternoon.
Here's what Dr. Bob said on acceptance. And acceptance is the answer to all my problems today. When I'm disturbed, it's because I find some person, place, thing, or situation, some fact of my life unacceptable to me. And I can find no serenity until I accept that person, place, thing, or situation as being exactly the way it's supposed to be at this moment. Nothing, absolutely nothing happens in God's world by mistake. Until I could accept my alcoholism, I could not stay sober. Unless I accept life completely on life's terms, which by the way are often unfair, I cannot be unhappy. I need to concentrate not so much on what needs to be changed in the world as on what needs to be changed in me and my attitudes. Now, a lot of people mistake acceptance for endorsement.
Real fast, Carl Jung on acceptance. He said we cannot change anything in life until we accept it. Condemnation does not liberate, it oppresses.
Lots of profound quotes.
Yeah, lots of profound quotes.
Maybe I'll go to Google later today and type in acceptance quotes. So acceptance is an important part of the therapeutic process and of hypnosis, because acceptance, paradoxically, is freedom. I have a lot of limitations with my feet and movement, and have had chronic pain and a number of issues and things like that. And I remember a couple of years ago when you have a fantasy, and that is when you have surgery, everything's going to be perfect afterwards, right? Because they're going to fix it. Well, surgery just makes the misery not the same. It actually doesn't make it better sometimes, it just makes it different. And so I actually had never really practiced yoga before this, but because of movement difficulties, there's a place in Tulsa called Tulsa Yoga Therapy. And so I went, and the yoga instructor works with people in physical rehab and things like that. So I went to his classes, and I remember the first yoga class I went to, I did not like my foot. I'd even said that. I just don't like my foot. And so I practiced yoga, and I learned to become roommates with my foot. And once I was roommates with my foot, and I didn't let my foot decide whether or not I could or could not enjoy life, then I decided that I could spend time with that foot. And I accepted it the way it was with its limitations. And although I dreaded surgery on the other foot, went into that with full confidence this past year, knowing that even if the outcome wasn't the way I fantasized it to be, it would be okay, as long as I still had feet. Some people aren't lucky enough to still have feet. And so an attitude of gratitude can also be coupled with acceptance. Oh sure, I'll never run again. I used to like going to the treadmill. That's not going to happen. So I've started to swim lately, because I can do that, and I've been doing it every single day. So much so that I've even bought underwater headphones, which is pretty cool, because I've become a serious swimmer, swimming gloves. I used to like to run, but now I like to swim. Acceptance. By the way, my feet still aren't perfect. I got these special shoes with the special stupid inserts with the doctor I'm supposed to be with next week, who's going to adjust them again. They're still not going to be right. And the reason why they're not going to be right is because the foot's not right. It's never going to be right. It's never going to be like it was when I was 20. It's not going to happen. They're screwed up feet. I was supposed to have braces apparently when I was a little kid. My mom didn't do it because she didn't want me to look silly. I could blame my mother, maybe. Or I could just move to a point of acceptance and gratitude. Wow, I have feet, other people don't. I used to use a cane, I no longer do. I got rid of my cane, I started dyeing my hair. I look 12 years younger, it's awesome. There's actually some positive things going on here. Acceptance. Acceptance doesn't mean you like something, endorse something. I wish my mom got me braces, I wish I didn't have feet problems. I wish, boy, I'm glad I live in the year 2015, because they couldn't have done these surgeries in the years 1915. Probably wouldn't be walking right now. Or in 1815, they would have killed me. Actually, in 1715, they probably would have burned me at the stake for being possessed by demons because my feet weren't perfect. Wow, there's a lot to be grateful for. Gratitude and acceptance are important. So here's a process I guide my clients through for acceptance.